The Deputy Minister of Health, Professor Dr. Grace Ayensu-Danquah, was on a working visit to the Northern Region, meeting with health workers, held talks with regional authorities and the Northern Regional Minister. She toured several health facilities with the regional director and his team to assess working conditions and equipment of these facilities, with a view of identifying areas for improvement. Speaking after the tour, the Northern Regional Director of Health Service, Dr. Crisantos Kobio, revealed that the region recorded 106 maternal deaths.
Target is looking at 125 per 100,000 live births. What it means is that for all women delivering a live birth, if you take 100,000, you are going to record 125 deaths. That is what it means. And if you are looking at it in terms of counts, that for 2025 we recorded 106. If you are looking at it in terms of the numbers per every week, it means that within every week for 2025, 2 mothers lost their lives in the Northern Region, and we think that it is huge.
The Deputy Minister for Health, Professor Dr. Grace Ayensu-Danquah, said she was determined to turn the tide in maternal deaths in the country.
I've been tasked with the maternal mortality issues in the country. As you can tell, the index is going up. So the Honorable Minister, Honorable Kobna Minta-Kando, has tasked me with making sure that we reduce those numbers, because those numbers are kind of alarming. That is why I'm doing this needs assessment and going around and including the maternal thing inside, because we need to work with data and we need to work with proper evidence. So we'll go around the country and do proper data collection and proper evidence. Then we'll make policy suggestions, go to the right places, and hopefully by the end of this year, we can at least, if nothing at all, we will reduce those numbers.
She said doctors were not keen on picking appointments at most regions and called for support to make these areas more attractive, hoping to stem the challenge.
The messages that I'm bringing, the first one, as the director said, is staffing. We have posted some doctors to different regions and different districts, and we seem to be having some problem there. Some of them have shown up, some of them haven't shown up. Those who have shown up are having a lot of issues, and so we are here to find out what the issues are and to ask you to help us support them. The problem we have is that we have a lot of health disparities. The disparities means that over 80% of our doctors want to go to Kumasi and Accra. The rest of the regions, we have it even difficult sometimes to get people to go there. We are posting 80%. So that means that it's left with 20% for the rest of us to share.
The Northern Regional Minister, Adolf John Ali, pledged the region's support.
One thing I've assured him is the cooperation from my outfit, and he knows very well. In Tamale here or in Northern Region, we're confronted with health personnel, especially in the rural areas, who want to be getting their way to the urban areas. And it got to a time. I have not vowed, but I've promised myself that I'm not going to be used for that. You are posted to where your services are needed. And these are part of the conditions of services.